Moses Cone is a health system that has 5 acute care hospitals, many tertiary businesses, and we're in the business right now of buying a lot of physician practices, so very complex structure.
Moses Cone has approximately 8,000 employees, and we have 5 acute care hospitals and a growing number of physician practices and community clinics.
When I first started at the hospital about 20 years ago, we had no, HR and payroll was totally separate. We outsourced benefits administration, we outsourced payroll, and at the time that we chose Lawson, we brought payroll in-house. We followed with benefits administration. So now it not only brought Lawson to the HR payroll staff, because we didn't even have access to those systems before. So it brought Lawson to the HR payroll staff, and it brought Lawson and then HR payroll information to our employees.
Well, when we implemented in 1998, we implemented only HR and payroll originally, and we actually did our implementation in about 6 months. So it was very quick, and it was, while it was a lot of work, it really was not overwhelming, and it was pretty easy to accomplish. We certainly had our moments of trials and testing, but overall to be able to implement a new system, bringing it all in-house in 6 months was a pretty big achievement. We also implemented then the financials and supply chain probably about 5 years later, and that was also a very fast and quick implementation, and our users adopted the product easily, and it made sense to them.
We've seen an incredible return on investment in the benefits area. We were paying about $250,000 annually for benefits administration, and we have brought all that in-house, and we do it ourselves now. So we've seen huge returns there. It's allowed us to do mandatory direct deposit because now employees have access to their check information, and that has saved us, we think, about $55,000 a year just by not printing checks. So there's lots of areas that it has saved us in the long run.
We use Lawson in a variety of ways at Moses Cone. One of the pieces that we think is very important is the employee manager self-service. That's a piece of Lawson software that's allowed us to provide services to our employees in a much faster manner, and to be more efficient, and as an example for their paychecks, instead of printing and sending them around by a person, they are deployed electronically, and employees have much quicker access so that they can review and we can correct any errors quickly, and that's a benefit for the employees. Managers were able to process actions on employees much quicker, and using a product that is easy for them to use, and we can put criteria and rules around what actions they do specific to that particular manager role, and that has been welcomed by our employees and our managers. And it's made their jobs easier to do so that they can concentrate on what they really do best, which is taking care of our patients.